If your liver could talk, what do you think it'd say to you? Most people probably don't give much thought to their liver, but the liver is one of the most important organs that we have. It carries out thousands of chemical functions. It rids the body of drugs, alcohol, toxins, and poisons, and it regulates our blood sugar to keep us alive at night while we sleep. So it's important to know whether you have a healthy liver or not. I started thinking more about the liver when my wife and I opened our fitness and weight management clinic back in 2006 here in Austin, and I began to see so many of our patients who had elevated liver enzymes, specifically ALT and AST. And at the time, I honestly didn't know exactly why I was seeing this so often. I knew all these patients didn't have hepatitis because they didn't have other symptoms of liver disease. They weren't yellow, they weren't jaundiced, but it raised my awareness and it made me alert that something was going on here that I just didn't fully understand. But at the time, I was also still working in the ER, and I would see similar patients in that environment who were overweight, who also had elevated liver enzymes. But the difference though was that in the ER, many of these patients were there for chest pain or abdominal pain, and they would often end up getting a CT scan of the chest or the abdomen, or possibly an ultrasound of the liver and gallbladder in the course of their workup. And invariably, even if there were no critical or emergent findings on these studies, the radiology report more often than not would come back saying something like this: no appendicitis or other signs of inflammation seen, and then they would write something as a side note. In addition, fatty infiltration of the liver is noted. And I started to see this correlation over and over again in patients who were either overweight or obese, and I just made a mental note of what I was seeing. Over time, as I became more interested in how type 2 diabetes developed and wanting to know more about what can be done to prevent or reverse it, it became apparent to me that the liver plays a key role in the development of type 2 diabetes. In fact, in Dr. Jason Fung's book, The Diabetes Code, he paints a very clear picture of how the liver is at the center of the development of insulin resistance and the progression to type 2 diabetes. He describes how the liver becomes overcongested with fat and how the pancreas has to work harder and harder producing higher levels of insulin to facilitate the storage of excess sugars and carbohydrates throughout the body. So for starters, the first thing that I want you to understand is that a healthy liver is not saturated with fat. If you have fatty infiltration of the liver, or simply fatty liver as it's so often referred to, this does not reflect good, ideal general health, and it's something you should be proactive about addressing. We now know that between 70 to 75% of people with type 2 diabetes have fatty infiltration of the liver, most often manifested as something called non-alcoholic fatty liver disease, or NAFLD for short. Non-alcoholic fatty liver disease is often a precursor to the development of insulin resistance, which over time often progresses to type 2 diabetes. In one study of pre-diabetic patients, individuals who don't yet have an actual diagnosis of type 2 diabetes, almost 50% of people studied were found to have fatty liver detected by ultrasound. And again, these were people who were not yet diagnosed as type 2 diabetic, and still they were showing signs of fatty liver disease. There's also another form of fatty infiltration of the liver called non-alcoholic steatohepatitis, or NASH for short, which is a form of fatty liver accompanied by inflammation within the liver and elevated ALT and AST. And because non-alcoholic steatohepatitis is becoming the #1 cause of cirrhosis in people with type 2 diabetes and the #1 reason for liver transplant, the American Diabetes Association has taken notice of the liver's significant role in the development and progression of type 2 diabetes. In fact, this past summer, 2023, a writer for Family Practice News, Miriam Tucker, shared that the ADA is now advising universal screening of people with pre- or type 2 diabetes for the presence of liver disease. The recommendation was published as an update to the ADA's Standards of Care Guidelines for 2023. The ADA is now advising screening of all adults with type 2 diabetes or pre-diabetes, and particularly those with obesity or cardiovascular risk factors or known cardiac disease, even screening patients who have normal liver enzymes but who are classified as pre-diabetic. I think this is great that they're recommending this because in general, I believe we're behind the 8 ball in acknowledging the link between the development of fatty liver and the tendency to progress in the direction of type 2 diabetes. The fact is, we all have a higher risk of developing type 2 diabetes because of the unhealthy, highly processed food environment in which many of us now live. And now that the majority of Americans are classified as either overweight or obese, an enormous portion of the population are likely living with variations of fatty liver disease as well as other health conditions related to it. So what can you do to find out if your liver is healthy? you can go see your doctor and ask about having some baseline liver enzymes drawn to include ALT and AST. Then request that they order either an ultrasound of your liver or a CAT scan of your abdomen to evaluate for the presence of fatty liver. The ADA is also encouraging doctors to use a screening tool called the Fibrosis Index 4, or the FIB4 for short, that takes into account a patient's age, their AST, ALT levels, as well as their platelet count, as an easy tool to estimate the presence of scarring or fibrosis that might be present within the liver. Liver enzymes by themselves are felt to be inadequate as a screening tool, especially since fatty liver is known to exist in many patients who may be overweight or obese but still have normal liver enzymes. Regardless, if you have blood work done and your liver enzymes are elevated and your doctor shrugs it off as not a big deal, I would encourage you to push for an ultrasound of your liver and also ask your doctor about the Fibrosis Index 4 scoring. I say this again because we now see so many people with elevated ALT and AST that I think their significance is often ignored, because by and large, the correlation between elevated liver enzyme, fatty liver disease, and their link to the progression of type 2 diabetes is not widely recognized by the majority of practicing doctors today. So what is the ADA recommending in terms of treatment for those with pre or type 2 diabetes or prediabetes and non-alcoholic fatty liver disease? Well, not surprisingly, they're recommending lifestyle modification, and we all know that that helps people get healthier. But also not surprisingly, they're recommending the consideration of the use of pharmaceuticals such as GLP-1 agonists like semaglutide, which have been shown to be beneficial in non-alcoholic fatty liver disease as an adjunct to lifestyle change for weight loss. For patients found to have progression to fibrosis within the liver, other pharmaceutical treatments are being recommended, but that's really beyond the scope of the video today. The main takeaway that I want you to know is this: the progression of type 2 diabetes is intimately tied to long-standing overstorage of calories throughout the body, as well as within the liver and other intra-abdominal organs. Lifestyle modification, which limits excess caloric intake and specifically the reduction of excess sugars and processed carbohydrates, have been shown to help patients reverse both type 2 diabetes and fatty infiltration of the liver. It can be done. The main thing is to talk to your doctor and ask for an evaluation of your overall liver health. The fact is that elevated liver enzymes have become like wallpaper to many of us as doctors, because their elevation is the norm in so many of the patients that we see every single day. Given the scope of obesity and type 2 diabetes in the United States as well as globally now, I think we're way behind where we could be in addressing this. And unfortunately, a lot of liver disease will continue to progress silently and undetected because it won't be investigated in patients who are overweight or obese but still have normal or just mild elevations of their liver enzymes. That's why it's important to not ignore this if you happen to be carrying extra weight or if you know you're pre or type 2 diabetic. Don't wait, go see your doctor and talk to them about your liver. Be a thorn in their side if you need to be, but make sure your doctor understands that you want the status of your liver health evaluated. Thanks for watching. Subscribe to the channel if you haven't already, and please share this video with someone you feel might benefit from watching it. Be well, and I will see you in the next video.